Welcome to the deep dive. Today, we're zeroing in on something really taking center stage in healthcare: patient-reported outcomes. PROs, for short.
Right.
It's essentially about your voice, your experience directly shaping your care, how you feel, how you're functioning day to day.
Yeah, it's not just about what the doctor sees on a chart or a lab test. It's your perspective.
And technology's playing a big part now, right? We're seeing more digital collection ePROs, electronic PROs.
Exactly. For a long time, the clinical view was dominant. Still vital, of course.
Mhm.
But PROs add this incredibly powerful layer, your actual lived experience of being ill or managing a condition.
So in this deep dive, we're kind of pulling apart different sources, looking at how PROs are being used, the good stuff, the benefits.
And the challenges, definitely. There are hurdles. We want to really get to grips with how this works in the real world,
Yeah.
Cut through the jargon and give you the core insights thoroughly, but hopefully without getting bogged down.
And it's not some niche academic thing anymore. Big players are involved.
Oh, absolutely.
You've got Joint Commission International JCI. They're huge in global healthcare quality. Their standards push towards better outcome measurement, and PROs fit right into that.
And in the U.S., you have CMS, the Centers for Medicare and Medicaid Services. They're actively prioritizing what they call PROMs, patient-reported outcome-based performance measures.
Right, using tools like the Medicare Health Outcome Survey.
HOS.
Yeah, HOS. And also photo patient outcomes. They're using these to gauge quality.
And it's global, you mentioned.
It really is. There's the PROM chronic study over in Germany, which sounds fascinating. They're looking specifically at digital PROs and PREMs. That's patient-reported experience measures for chronic conditions.
Like asthma, COPD, diabetes.
Exactly. Heart disease, too. Seeing if digital collection makes a real difference for those patients. And you see similar pushes elsewhere, like India's NABH, the National Accreditation Board for Hospitals and Healthcare Providers, setting up accreditation.
Plus international bodies like ISQOC, International Society for Quality in Healthcare, yeah. They're all promoting this focus on quality and safety where the patient's perspective is key. It's definitely a shift.
So our goal here, as always, is to give you that quick but deep understanding, connect the dots, maybe have a few aha moments without feeling overwhelmed.
Let's do it.
Okay, so let's start at the beginning, again, just to be crystal clear. What exactly are PROs and why all this buzz now?
Okay, yeah, let's unpack that. So PROs are, quite simply, any report about a patient's health status that comes directly from the patient.
Without interpretation by a clinician or anyone else.
Precisely. That's the key difference from, say, a doctor noting down their assessment. PROs capture your personal take on things, symptoms you're feeling, how well you can do daily tasks, your overall well-being, quality of life.
Even your experience with the care itself?
Yes, that too. It's the patient's voice on all those aspects.
It's your health story told by you, a different lens.
A really important lens. And the growing interest, well, several big things are driving it. One is just the sheer scale of chronic disease globally.
The numbers are pretty stark, aren't they?
They really are. You hear stats like 1 in 3 people worldwide having at least one chronic condition. And in industrialized countries, it can be, up to 60%?
Wow.
These are conditions people live with long term. To really understand the impact on their lives, you just have to ask them directly.
Makes perfect sense. A doctor only sees a snapshot during a visit. If you live with it daily, your insight is crucial.
Exactly. And this feeds directly into that whole movement towards patient-centered care.
Yeah.
Shared decision-making.
Right.
A core part of person-centered care is having engaged patients giving feedback on outcomes that actually matter to them. PROs are fundamental to that. It positions you as an active partner.
Not just a passive recipient of treatment.
Correct.
And how do you actually collect this? It's not just a chat, presumably.
No, it's usually more structured. Often through questionnaires, patients fill out themselves. Could be on paper or increasingly, like we said, electronically.
Or interviews.
Or interviews, yes. But even with an interviewer, the rule is they capture your words, your perspective, without adding their own clinical judgment. The source is always the patient.
Got it. So we know what they are, why they're gaining steam. Let's dig into the benefits. What are the real advantages of using PROs?
Okay, benefits. There are quite a few significant ones. Firstly, PROs often give a more accurate reflection of how you're actually doing compared to just a clinician's report.
Because you're living it 24/7.
Exactly. You're the expert on your own experience. It's not just about symptoms a doctor might miss. It's about how you prioritize them. Maybe fatigue is hitting you harder than a lab value suggests,
Yeah.
That changes the picture of treatment success.
That's a great point. What looks minor clinically might be major for your quality of life.
Precisely. And when you have that more accurate picture, it can really enhance the conversation between you and your provider.
Better communication.
Yeah, potentially much more targeted conversations. You can
Wow.
focus on what's impacting you most. And that, in turn, can lead to better health outcomes because the care plan gets tailored more precisely to your needs and your progress.
So it's not just feeling heard, it's the information leading to actual changes in care. Makes sense.
Exactly. And then stepping back from individual care, PROs are also super valuable for evaluating healthcare quality overall, those POPMs we mentioned. Performance measures.
Right.
They allow comparisons between providers based on what their patients are actually reporting about their outcomes and experiences.
And that German study, PROM chronic, you said they're looking at identifying low-value care.
Yes, that's part of it. Using PRO and PREM data to potentially spot treatments or interventions that aren't delivering significant benefit from the patient's point of view, that's huge.
Cutting out things that don't really help people, that would be a massive win.
Absolutely. And another thing, PROs can be really empowering for you, the
Wow.
patient. Well, getting information on your own health status, maybe even seeing how it compares to others with similar conditions that can help you understand things better, participate more actively in decisions.
And maybe stick to the treatment plan better.
Potentially, yes. Improve adherence. Seeing your own progress, or lack thereof, can be motivating.
That comparison piece is interesting. Could give context, maybe a sense of community even.
Right. And there's even some evidence of a sort of nudge effect. When you get feedback from your PROs, it might subtly encourage positive behavioral changes.
Like healthier habits or managing your condition more proactively.
Exactly. And maybe more mundanely, but still importantly, EPROs can reduce the administrative hassle. Less paperwork for everyone compared to the old ways.
Less paperwork, better health potential. Sounds good. But okay, it can't all be smooth sailing. What are the roadblocks, the challenges in actually making this work widely?
You're right. It's not just plug and play. There are definitely challenges. One big area is technical.
Getting the systems to talk to each other?
Yeah, integrating EPROs smoothly with existing electronic health records, EHRs. That can be really complex. It needs smart tech design, careful workflow planning.
Interoperability issues.
Big time. Different systems not speaking the same language. That's where things like LOINC terminology become important.
LOINC, what's that?
Think of it like a universal translator for health data. Different EHRs might use different codes for the same thing, like a specific blood pressure reading. LOINC provides standard codes so data can be shared and compared accurately. It's crucial for making EPRO data flow properly.
Okay, so getting the tech right is foundational. What else?
Workflow disruption is another major one. Bringing PROs in means new tasks for people, doctors, nurses, medical assistants, maybe psychosocial providers too.
And it can feel like just more work, task overload.
It can definitely be perceived that way, yeah. Especially if it's not clear how this data will actually help them in their daily practice or improve outcomes efficiently. It's not just about the time, it's about the perceived value added to their work.
I can see that. If it feels like another box to tick without a clear payoff for them or the patient right then and there.
Yeah.
Yeah.
Exactly. Then there are questions around the data itself. Is it accurate? And crucially, is it actionable?
Meaning, can the doctor actually do something useful with it easily?
Right. Providers need to trust the data, but they also need it presented clearly. They need insights they can act on. If it's just a data dump, or if they can't easily see trends over time, that's a barrier.
So the presentation and interpretation matter hugely.
Absolutely. Then you have patient factors. Some people might be reluctant to fill out forms, maybe due to time pressure during appointments or just feeling overwhelmed.
Health literacy could be an issue too.
Definitely. And you need measures that work across cultures in different languages.
Yeah.
And just the burden on the patient, long questionnaires, complicated questions, that's a key thing to manage. You don't want the reporting process itself to be a negative experience.
No, you want it easy, accessible. Make it simple to share their experience.
And then, relatedly, there are provider factors. Maybe a lack of awareness about the value PROs bring, or uncertainty about, how do I actually use this score in my decision-making?
Or maybe no real incentive to use them routinely.
That can also be a factor, yes. Sometimes the incentives aren't aligned yet.
Seems like education and demonstrating the value proposition for providers is key.
For sure. And we shouldn't forget the challenges in actually designing the PROMs, the questionnaires themselves.
What goes into that?
Well, figuring out the best way to collect the data, Choosing the right questions, phrasing them clearly, considering reading levels, cultural nuances, even the order and layout matters.
And making sure it measures what you think it measures.
Exactly. Is it measuring one specific thing, like pain, unidimensional, or several related things, like physical and mental function, multidimensional? And how do you score it and report it meaningfully?
And there was that point about negative reactions.
Yes, that's an ethical consideration too. If a patient sees their PRO scores are worse than, say, a peer group, that could be upsetting.
Yeah, that could be tough emotionally. Seeing data suggesting you're not doing as well as you'd hoped or compared to others.
Right, so you need support systems and context around delivering that feedback. Guidelines are being developed around the ethical use of PROs, particularly in research.
Wow, okay, so
Okay.
quite a few interconnected hurdles: technical, workflow, data quality, patient factors, provider factors, design, ethics.
It's a complex ecosystem.
So, given all that, what's being done to smooth things out? What efforts are underway to tackle these challenges?
Well, thankfully, quite a lot is happening. Studies like PROM in Germany are doing vital work, specifically looking into patient reactions to the feedback. Is it understandable, useful? Does it cause distress?
Learning from experience.
Exactly. And there's a huge push towards user-centered design for the technology, really thinking about the clinicians using it.
Like,
Well, for example, early feedback showed nurses found it disruptive to click away from the main patient chart to enter PRO data. So now designers are trying to integrate PRO entry right into that main view in some EHRs. Little things like that make a big difference.
designing with the user workflow in mind from the get-go makes sense.
Totally. And we're seeing clear recommendations emerge on how to address the challenges. Things like streamlining data collection, setting up automatic referrals if a PRO score hits a certain threshold.
Oh, interesting. So the system could flag something automatically.
Potentially, yes. Also, improving data visualizations, making charts and trends easier to grasp quickly, developing better educational materials for patients and providers, and exploring those incentive models we mentioned.
So really attacking it from multiple angles.
Definitely. Things like reminder systems to nudge patients to complete EPROs, making the digital interfaces super simple and user-friendly. That helps with adherence.
And the questionnaires themselves, are they getting better?
There's constant work there. Developing and validating new PROMs. You have generic ones, useful across many conditions, like the SF36 or EQ5D. You've probably encountered those.
Vaguely familiar, yeah.
And then very specific ones, targeted at particular conditions, like there's an adult asthma quality of life questionnaire or the Seattle angina questionnaire for heart patients. Having the right tool for the job is key.
And making sure those tools are actually good, reliable.
Absolutely. That's the psychometric soundness piece.
Yeah.
We need to know the questionnaire is reliable, gives consistent results, and valid measures what it claims to measure.
Like ensuring your measuring tape is accurate.
Exactly.
Yeah.
And that it's actually usable and feasible to implement in a busy clinic. It's no good having a perfect measure if nobody can realistically use it.
Right. It sounds like the whole field is learning, iterating, refining both the tools and the process.
That sums it up perfectly. It's an ongoing evolution, trying to really harness the power of the patient's voice.
Well, this has been incredibly insightful, a real deep dive into PROs. To sort of wrap things up, what are the main takeaways for our listeners?
I think the core message is that PROs provide this incredibly valuable lens onto your health, your experience. They're really driving healthcare towards being more holistic, more genuinely patient-centered.
And it's not magic.
No, the potential is huge. Better understanding, better communication, hopefully better outcomes. But making it work well requires real effort. We need to get the tech right, integrate it smoothly into workflows, and really consider the human side for both you, the patient, and the healthcare teams.
So it's as much about changing culture and process as it is about the technology itself.
Precisely. And keep in mind, this field is moving fast. PROs are getting woven more and more into research, into quality improvement work.
And maybe even into how care gets paid for.
Additionally, yes, that's starting to happen too. It's a really dynamic space.
Okay, so a final thought for you, the listener, to mull over. With this increasing focus on patient experience and value in healthcare, how do you think widespread use of PROs might fundamentally change the relationship between you and your doctors, your nurses, your care team in the coming years? And maybe what role could you play in that shift?
It's a big question. Definitely food for thought. We really encourage you to look into some of the sources and initiatives out there if this sparked your interest. Thanks for joining us for this deep dive.